Okay, so today we are talking about managing anxiety in working mothers, and with us is Dr. Wolford. Thank you, Dr. Wolford, for joining us today.
Thank you for having me, Zara.
To start off, can you share some common sources of anxiety that working professional mothers can experience?
Yeah, there are many sources of stress that working mothers experience, and many things that contribute to this as professional mothers. Um, this includes trying to balance our careers while parenting
Mm-hmm.
and while maintaining a home, and at the
Right.
same time while trying to balance social responsibilities, self care, and hobbies. So, the pressure to excel in both professional and personal areas of our lives can lead to feelings of overwhelm and guilt and anxiety. So, balancing work deadlines can
Mm-hmm.
contribute to this as well.
Are there other sources of anxiety?
Of course. Another big one is if the workplace environment is not friendly
Mm-hmm.
or accommodating to working mothers, meaning that it's not flexible and it could lead to difficulties with having to manage unrealistic job expectations, deadlines. It can be stressful. Well, final example is also it can be stressful to navigate the transition from work, no
Mm-hmm.
matter what the work is like, to home life. And having to take off your professional hat and switch to your parenting hat. That can be a difficult.
I can totally relate to that. Can you explain more about this transition?
Yeah. Shifting gears after
Mm-hmm.
after having, like I said, your professional hat on,
Right.
to having to focusing your attention on your goals towards parenting your children. And that can include providing nutrition,
Mm-hmm.
making sure that your children are consistently exposed to positive influences while their brains are developing and learning to navigate social situations. It can be difficult to routinely do this, especially if you're experiencing work related
Mm-hmm.
stress. So you see, we're constantly trying not to let our work life interfere with our home life,
Right.
um, and at the same time, trying not to let our home life interfere with our work life or negatively impact that. And so we're simultaneously trying not to worry about all of these things, that it's impacting our responsibilities. It can
Sure.
get in the way of our professional goals and personal responsibilities.
Right, definitely. What about some examples of useful of a stressful professional situation that might make this transition difficult?
Um, well, one specific job duties
Mm-hmm.
can create an emotional reaction that's difficult to shift
Right.
out of. Work related deadlines and interactions with clients
Mm-hmm.
or patients or customers
Mm-hmm.
can contribute to stress, as well as negative interactions at work that spill over into our personal lives. Additionally, depending on the job, supervisors and managers on a daily basis contribute to additional stressors, or they can. This is especially problematic when um, a manager doesn't value work life balance
Right.
and doesn't support our professional
Mm-hmm.
development. And many women also work in particularly
Mm-hmm.
stressful fields: healthcare, teaching, first responders,
Right.
customer service. Those all can be really stressful.
And how can this anxiety and stress impact our overall well-being as a woman and as a mother?
Well, for anyone, anxiety and stress, if left untreated, it can impact us in many ways. It
Mm-hmm.
can cause but problems with both physical and mental well-being.
Mm-hmm.
It can lead to symptoms such as headaches, fatigue, irritability, and
Right.
difficulty concentrating. Chronic anxiety can also contribute to significant health problems,
Mm-hmm.
including cardiovascular issues.
Right.
Emotionally, it could just put a strain on our relationships, negatively impact our professional abilities, and just interfere with our overall quality of life.
Sure. Yeah. And are there any personal factors that may contribute to our stress levels?
Well, different cultures certainly bring different expectations,
Mm-hmm.
especially for women,
Right.
um, especially for professional women who are parents.
Right.
This has been known to trigger different sources of stress, while potentially veer from social or cultural norms,
Right.
and this can contribute to increased anxiety.
Sure. And are there ways in which anxiety can impact our thinking?
Yes, very much so. Possessing negative thoughts and worries is a hallmark of anxiety.
Mm-hmm.
So we begin to feel guilt and shame, or we can begin to feel guilt and shame, and this contributes to negative thoughts about our
Right.
abilities
Mhm.
and about ourselves and our roles.
Right.
It's important to recognize that feeling overwhelmed and stressed out does not mean that we're unaccomplished. We as professionals are also who are also mothers are doing much, too much.
Mm-hmm.
Nobody's meant to do this much.
Right. Right.
And so it's impossible to handle all the things that we're trying to do being mothers and professionals
Sure.
and managing the busy lives of motherhood while
Mhm.
running a household and managing the lives of our overscheduled
Mhm.
children, and then also trying to maintain some sort of social life and, like I said, self-care. So it's helpful
Right.
to recognize when you're having these unhelpful thoughts that I mentioned
Mhm.
or automatic thoughts, and to
Mhm.
shift your focus on what is working and your
Mhm.
accomplishments rather than focusing on what's not working.
Yeah, definitely. It's very hard. It can be hard to focus on accomplishments and
Yes.
be very self-critic rather than cheering our success. So I was wondering, what other coping strategies do you recommend for managing anxiety?
Well, like I said, one can, since it's so hard to focus on accomplishments rather than perceived failures, it could be helpful at the end of the day to recognize three things that you accomplish each day.
Mm-hmm.
It's very likely that you accomplish many more than three things,
Sure.
but just three things each
Right.
evening. And this can be something common from picking up your children
Mhm.
on time for school, answering all of your emails in one day, or making a healthy dinner. I mean, we tend to focus on what we did not get done rather
Mhm.
than what we did get done. And that sets ourselves up for failure. So if you could just focus on three things that you accomplish, that could help a little bit.
I think that we all can agree that a little more self-care can also improve our life and reduce our anxiety.
Mm-hmm.
What other coping strategies can you recommend?
Well, there's many, but some important ones are focusing on self-care and setting boundaries, prioritizing self-care. So it might seem impossible to do this in consideration of all of our other responsibilities, but taking care of oneself will make you a better parent, a more efficient and happier professional,
Sure.
and a better spouse,
Right.
friend, and neighbor.
Yeah.
So self-care can include setting realistic expectations, learning to say no when necessary,
Mm-hmm.
and carving out time for activities that you enjoy and that you find relaxing. Regular exercise, adequate sleep,
Mm-hmm.
and a healthy diet all play
Right.
a role in self-care. They're crucial, actually. So developing effective time management skills is also a good coping strategy. And then, of course, seeking support from partners or family members or friends can help us be able to implement self-care on a regular basis.
I think that we can all benefit from self-care and we can all agree on this topic at least. Um, what other self-care techniques?
Um, well, another good form of self-care is sustaining a healthy support network. And this isn't just your spouse or your family, which are very important, but also a lot of people could benefit from the help of a therapist, a coach, a
Sure.
business mentor, to determine, what tasks can be deleted or delegated, because sometimes it's hard to determine that for ourselves. And of course, this can also include our friends and family. So when you're meeting a deadline at work or when you're planning a special event, it's important to ask for help. And this can be a real strength to do that, and also to know when to delegate things and lean on others for support.
I totally agree with that. Sometimes as a woman, as a professional woman, we want to have everything on our hands, so there's a little bit of hesitation on asking for help. But you mentioned something about boundaries, and I would like to know more about what did you mean exactly by setting boundaries?
Well, when I mentioned boundaries, that means setting clear expectations for yourself, what your work hours are, and what your personal time is. And this routine will look different for each person, and there's no right or wrong way to do it. But to be clear that if you decide that you are going to end your workday early to be there to pick your children up from
Mhm.
school, and then you're willing to work in the evening or on the weekends to make up for it. Or if you decide that you want to delegate some family responsibilities and you want clear work boundaries, then to have those potential emergencies
Right.
or home life responsibilities delegated when needed when something's pressing at work if they're within your work
Mhm.
related boundaried hours.
Sure.
So there's no right or wrong way to do this. It's
Right.
important to keep in
Right.
mind.
So to recap, it's important to have boundaries, but there is no right or wrong way to do it. Everybody's boundaries is different.
Yes, exactly.
Okay, great, love that. Are there any specific cognitive or mindfulness technique that you can recommend to professional mothers for managing anxiety?
Absolutely. Mindfulness based techniques such as deep diaphragmatic breathing exercises, brief periods of meditation, and mindfulness based stress reduction, or MBSR, are highly effective in managing anxiety. So, cognitive behavioral strategies are also effective in identifying and challenging negative thoughts and patterns and developing more balanced coping thoughts that can also be beneficial. Also, incorporating relaxation techniques such as progressive muscle relaxation and imagery can help the physical tension that's caused by anxiety. Practicing yoga and yoga nidra are each effective techniques to foster calm and relaxation in our bodies.
I personally practice yoga and nidra, and I benefit a lot from it.
Yeah, and I practice yoga too, and these are all these skills that I'm mentioning are skills that one can learn in therapy
Right.
or from workshops or self-help books or YouTube and various videos.
Sure, yeah. Any other thoughts on how the demand placed on working mothers contributes to their anxiety?
Yeah, actually, a recent poll that I came across that surveyed working mothers found that 42% of working mothers experience significant symptoms of anxiety or depression. Um, Federal paid leave policies, along with boundaries in the workplace and a reliable support system, can help
Right.
alleviate some of the burden that working mothers are experiencing. We, as professional mothers, may have demanding jobs in our chosen careers, but we're also coming home and working as the CEOs of our homes and our families.
Well, thank you, Dr. Wolford, for joining us and sharing these valuable insights about how we can manage our anxiety as a professional working mother. I really appreciate your time.
It was my pleasure, and I hope these suggestions prove to be helpful for professional mothers in finding that work-life balance and managing anxiety.
Definitely, yeah, definitely. I really appreciate your time here, and thank you for you listening to this episode. I really hope you find the information useful. And until next time, take care of yourself.